Bladder cancer is most common in older people. It's usually where you find blood in the urine. And when you find blood in the urine, it needs to be evaluated. And you usually find a little superficial tumor inside the bladder. Let's say the bladder is like a basketball. And you go on the inside. Well, you can scrape off most of those. Most of them are superficial, but they may recur. And so the treatment usually is very effective, 70%. Who's at risk? Smokers, people that are working with certain dyes, people that are working making paints. Those seem to be absorbed. They're excreted into the bladder, and the bladder can develop cancer. If the cancer goes deeper, then sometimes the bladder has to be removed. There's lots of new treatment that allows us to have an internal, or maybe even in the future, an artificial bladder. And so know that the treatment frequently just simply means they can scrape it off. Now, if they start recurring, the little superficial ones, and you have to have cystoscopy about every 6 months, then there is something called BCG that we can put inside the cancer that will begin to build up the body's own immunity. Great advances in medicine, great treatment in medicine, and that includes bladder cancer. If you have blood in the urine, be sure that you get it checked. Sometimes it's only microscopic. That means you need to have a urinalysis by your doctor.